streaming, please.
Okay, good evening everybody and welcome to the meeting. My name is Charles Marlitz, I'm the Executive Member for Adult Services and Public Health in Wokingham. To move on to the agenda of the meeting tonight, first of all, could I have any apologies please, Madeline?
Yes, Tessa Linfield, Sam Burrows and Debbie Milligan.
Is anybody else aware of any other apologies? Take that silence as a no. So the next agenda item is the minutes of the previous meeting, to confirm the minutes of the meeting held on the 10th of September. And if I could ask anybody who requires any amendments or any changes, just say so now, please. Okay, so those minutes are now passed. And do we have any declarations of interest in them? No, okay, and then we're on to public question time. Do we have any members of the public here?
We don't have any public questions.
So then we're on to member question time.
We have a question, but the questioner doesn't appear to be in the meeting at the moment.
Okay. Would you like me to read the answer, Madeline, or just wait and see if she turns up?
It's within your discretion, Chair, if you would like to go back to it, to give them a bit more time, and if they don't make it into the meeting, you'd like to read it.
Okay, well, I think I'm happy to hold that to the end and just see what happens, unless anybody has any objections. So then we're on to item 21, which is strategy into action. And could I ask, I believe Ingrid's presenting that, unless I'm wrong. So that's page 9 of the agenda.
Thank you, Charles. Yes, it is me. I think you've all got the papers in front of you on the agenda. So I'm just going to give a really brief summary this evening, because we've just had 3 weeks really to put things into place. And this is an update on our action groups around the Health and Wellbeing Board strategy. So there's a presentation there in Appendix A, which outlines how we're moving forward with each of those groups. So each action group aligns to one of the Wellbeing Board priorities. And the aim of each group is to develop a stronger understanding of the performance and successes of work being carried out, both within the local authority, with our partners and with our providers, to give us a sound footing on which to evaluate and inform our future planning and to see how we can best provide for our residents in Wokingham. There are 3 then, obviously, groups. The first is the Physically Active Communities group. Sports and Leisure within Wokingham Borough Council have agreed to co-chair that group. And the first meeting of that group is due to happen in the first week of November. So that group is ahead of schedule, and engagement of all partners listed in the presentation there has begun. The second group is Reducing Social Isolation group, and we've engaged with Phil Cook and Involve, and he's kindly agreed to co-chair the Social Isolation Action Group. There is discussion around how we will be using what available evidence there is to define the current need around social isolation in Wokingham, and the potential for there to be a piece of work there to help us gather some data to fully understand the current situation in Wokingham on which to build our services and measure their performance. And the third group is the Health Inequalities group, that I'm very much hoping to work closely with the Children's Services on this group, and I know that Carol has engaged in that process. So that both of those, the Health Inequalities group will be meeting, we hope, in the beginning of December, and the social isolation one also before the end of the year. Draft terms of reference have been drawn up, but obviously those will be agreed once the groups are in place amongst each other. And in terms of coming back to this group, the aim of those each of those action groups is to have a standard reporting mechanism into the Wellbeing Board, so that we have a much more robust route in with performance and indicators and outcomes. So that's the aim of that, and we hope to have that up and running by early in the new year. That was my summary of the report. So if there's any questions.
Thank you. I had a quick question, Ingrid, if I may, which was, I know group 2, reducing social isolation and loneliness. Now, obviously, with the COVID situation currently and the possible need to restore some of the voluntary sector response, my question was, had you considered possibly asking either Jake Morrison or somebody basically from the voluntary sector who's involved with that, possibly Martin, without meaning to ask Martin to take on extra work, to have some involvement in that?
Yeah, so that's the group that Phil Cook is going to co-chair with us with involved. So the voluntary sector will be heavily involved in that middle group around social isolation. But I think you make a really good point, Charles, that COVID is going to have a huge, well, it will impact across the board, but will have a huge impact on that second group. And what we need to, that's partly around what I was talking about around data collection, to understand where we are with that, because I think that things will have shifted a lot in the social isolation group, and it would be useful for us, well, very useful, I think necessary for us to understand where we're coming from at this point around the effects that COVID has had, so that we might effectively address those issues. And I have begun conversations with Martin about that, about how we might get that data collection together through that group.
And if I can come in there.
Sorry, go ahead, Martin.
No, sorry, it's Phil Cook.
Oh, my apologies. Phil first, then Martin. My apologies, I couldn't see Phil there. And I know Katie's got a question after.
I was just going to almost back up what Ingrid was saying, as to say, you know, if with me co-chairing, that's part of the Friendship Alliance, which is Age UK Berkshire, the Link Visiting Scheme and Wokingham Volunteer Centre. All of those organisations have been heavily involved in the COVID response. And we still have the Voluntary Sector Action Group meeting every Monday morning. So you know, that connection and link is still very strong and is there. And one of the things that Ingrid and I did discuss is, you know, how big do you want these groups to get? Because suddenly you could invite lots of people and then you don't quite tackle what you're trying to tackle. Hence why, as I say, I'm quite happy to take that co-chair position.
Okay, thank you, Martin.
Yeah, I was just going to add a little bit to that. Just, that was part of the reason for setting up the Friendship Alliance, to tackle social isolation, and our integration board has funded a scheme to the value of about 100,000. So we are putting funding into this to really tackle social isolation. So at some point we should come back and actually do a presentation to this group, you know, on the progress, because there is significant progress being made around tackling social isolation.
I think that I would welcome that, Martin. I think that's very important at the moment, so I would certainly welcome that. And if I could go to Katie now, unless there are any other questions down that line.
Right, I've got two questions. On that social isolation point, a lot of the proposed long-term success markers are related to children. And Ingrid, we didn't necessarily relate to how we're involving any of the education support services into that actual socialisation conversation. Lessons learned from my perspective are that you've got to look at it from an attainment perspective. So are we incorporating education into that conversation as well? The second point on the actual reducing health inequalities, again, I'm really pleased about this group and actually fully support it going forward. I really want to build on that to say that actually the whole of the NHS have now been set an action plan on reducing health inequalities, and we have 8 high impact changes that we all have to actually deliver over until sort of by December next year, and those are to protect the most vulnerable from COVID. So they're looking for local place-based plans to be updated and potential for inequalities, how they will be addressed. We've got to be restoring NHS services inclusively, and we're going to be monitoring now people that are come from the most deprived areas as well as the BAME community, and that's got to be in place by the 31st of October. We've also got to be thinking about digital inclusion, and that's a really big piece of work, especially when we think about inequalities, because one thing that we are tending to do is make decisions that is going to affect everybody, and we're not necessarily thinking about the most deprived areas, especially when we're rolling out digital support services. The fourth one is about proactive engagement with prevention. Fifth is mental health. Sixth is leadership. Seventh is completing timely data sets. And I would say that actually when you look at the proposed long-term outcome measures, I think actually what we've got to do is put increasing the data sets, recording of the accuracy and consistency of data is really, really vital, because evidence that shows that actually it tends to be very, very poor. The eighth is about collaborative local planning and delivery. So I personally think we've Ingrid, I think I need to work with you about actually looking at that actual third priority, narrowing health inequalities, and making sure there's some work that links in with those eight high impact actions as well.
Yeah, thank you, Katie. Absolutely, we'd really welcome the CCG's input into that third pillar. I think it's important that that's linked up, especially through the health inequalities action group. And just to pick up your first point in around priority 2 and social isolation, Carol and I will definitely work towards and address having education in that group. The other people that we are keen to have in that group are care leavers or representatives from care leavers, so that that's covered as well.
Also, a point to note what happened this week, hot off the press on Thursday. The GP contract has had some changes, and each GP practice has to start now increasing the coding of ethnicity in their GP practice. It's now mandated within their contract. So we are going to definitely see an increase in the number of people that are being recorded from the BAME community going forward. So that is something I think we should celebrate.
Okay, any other questions, any other points on that? No. Ingrid, can I say I think that's very good. What the most important thing about that is we've got some firm timelines on there, so thank you for that. Now, I believe Rachel may be with us, and if she is, if she'd like to ask a question, I've got the answer right here, and we'll be happy to do it.
Fantastic. Can you hear?
Yes, go ahead, Rachel.
Thank you. I was going to ask what steps the council is taking to protect our older and our BAME residents, who are both statistically at much higher risk from COVID-19 during this current second spike pandemic. And in particular, will we be helping to publicise the importance of vitamin D for older and BAME people? With BAME people currently 64% of WBC residents. Many medical professionals are concerned that there may be a link between vitamin D deficiency and higher rates of COVID mortality, as the deficiency affects your ability to fight infection. While research is still underway, the problems with vitamin D deficiency are so well known that before the pandemic, NHS guidance suggested that BAME Brits should consider taking vitamin D supplements year round, and white Brits to consider a supplement October to March. Care home residents have a particularly high vitamin D deficiency. Publicising this simple step, which local residents can take to safeguard their health, could be a very cost effective. And I sent through ahead of the meeting some information about a campaign which a nurse had undertaken to do this elsewhere in the country.
Thank you. The protection of our residents is who are vulnerable to COVID infection, including older residents and BAME residents, is priority to WBC. In addition to the extensive work we've undertaken with the care homes by the Care Home Task Force, we continue to work really closely with the voluntary sector within Wokingham and extended funding to continue the One Front Door service until March 2021, as I'm sure you've seen. This is run by the CAB Wokingham. They're taking calls and emails from residents, putting them in contact with any people or organisations they need. This includes prescriptions, collection, shopping service, but also helps with a range of other COVID-related effects such as debt advice, job loss, benefit advice, as well as important support for mental health and well-being. The Wokingham Borough Community Response is an additional support service to the NHS, social services is also for everyone. We're working with CAB Wokingham First Days, the Link Visiting Scheme, Involved Community Services and the Woking Volunteer Centre, as well as all town and parish parish councils, Age UK, Churches Together and other churches and voluntary organisations across the borough. In August, the council launched Tackling Racism Matters, which is an online survey providing an anonymous platform for both the wider community and staff to share opportunities to tackle all racial inequalities which affect the risk of COVID infections and deaths in Wokingham. In addition, the council has launched the COVID Impact Survey to understand fully how COVID has affected BAME groups during lockdown. The findings from this survey will continue to inform our response going forwards and will obviously affect how we behave. Working with public health team, WBC are moving towards our cascading tailored health promotion as developed by Public Health England to inform specific ethnic groups about minimising their risk to COVID transmission and mortality. The promotion materials have been adopted into different languages. The NHS test and trace system has been designed to ensure that anyone who develops the symptoms of COVID can be quickly tested to find out if they have the virus. The service also includes targeted asymptomatic testing of NHS staff, social care staff and care home residents. The test and trace service is an equal access service that does not discriminate on the basis of age, ethnicity or religious beliefs. You'll be aware, of course, of the recent decision of the council to also for its own testing for emergency use, which works the same way. In June 2020, the National Institute for Health Care and Care Excellence, NICE, published an appraisal of the evidence relating to vitamin D in the prevention of COVID. The study states that there is no evidence to support taking vitamin D supplements to specifically prevent or treat COVID-19. However, all people should continue to follow UK government advice on daily vitamin D supplementation to maintain bone and muscle health during the pandemic. The UK government advised all people should consider taking a daily supplement containing 10 micrograms of vitamin D during autumn and winter months. They also advised that people whose skin has little to no exposure to sunlight and ethnic minority groups with dark skin from African, Afro-Caribbean and South Asian backgrounds should consider taking a vitamin D supplement all year round. Since there is no evidence to support taking vitamin D supplementation to prevent COVID, there are no plans to promote the importance of vitamin D with regard to COVID. However, we will fully keep this under review and keep our eyes out for any new evidence that should come to light. And if we see anything on those lines, we'll of course review that position. As with everything in relation to this pandemic, our position remains that we're taking the best advice, listening to what's going on, making the best judgment we can, and not adopting fixed positions. Just keep moving forward as things develop. Sorry, that was such a long answer.
Okay, thank you very much. So I think what I've taken away from that is that you're going to be running with what Public Health England provide you with, but you will look, if stronger evidence emerges that there is a link between vitamin D and protecting BAME people and older people in the pandemic, you would be prepared to look again at whether you put out some targeted communications for those groups.
Absolutely. I mean, our position all the way through this as WBC is obviously this Public Health England and the advice we get from NHS experts. But, if we see strong evidence that convinces us that a different strategy is better, we're always open-minded. Our first and only priority is the protection and the health of Wokingham residents.
Fantastic. Can I ask a supplementary as well, which I did send through to the group ahead of the meeting?
Of course.
And the supplementary is about flu vaccinations. So to protect the NHS and care services, free flu vaccinations are available for older residents and now also to shielding residents, care home staff and their families. There are already some worrying signs that there will not be enough vaccinations available for those who want them, with some local providers having no vaccine in stock. Do we believe that there will be enough flu vaccinations available this year, and how will we handle any shortfall?
I'm going to give you the answer I've got in front of me, and then Katie's got her hand up. I want her to come in with anything that's behind me.
Super.
Which is the CCG and wider Bob Flu team are in regular contact with the NHS and public health to monitor and oversee the successful supply and provision of the flu service to patients across Berkshire West. So far, we haven't had any issues or delays reported to us with the delivery of pre-ordered stock to practices. We anticipate further guidance arriving this week from NHSE, explaining how our practices can order from nationally procured vaccine stock. Access to this stock is vital to ensure our practices can both achieve the national vaccination targets set by NHSE and meet the additional patient demand which we have seen this year. Pharmacies will also have access to ordering from the NHSE stock in the current weeks. All I will say is I know from sitting in other meetings this board, stock is normally ordered in January before for the winter. So obviously stock ordered in January 2020 was before the pandemic hit. But I'll hand over to Katie now to add anything that she sees of merit.
Thank you. Hello, Rachel. I'm Katie Summers. I'm from Berkshire West CCG. Lovely to meet you.
Hi.
That response is exactly what we would say as well from Charles regarding the flu. We haven't necessarily seen anything at all. There's a supply issue at all at the moment. And actually, we keep on getting general updates directly, and we're working very, very closely with the local public health teams. And as Charles says, we're very much on top of things. The only comment I was going to supply to the vitamin D piece is Charles is very, very right. We will actually take a decision when anything physically changes. And one thing that we have in the health services, we have what's known as the Thames Valley Priorities Committee, and they respond so quickly to the latest evidence. And so that Priorities Committee, if there is anything that changes related to the BAME community, they will act on it straight away, and there will be a policy that goes out across all clinicians to give them the guidance. But that will be, obviously, that's just backing up what Charles was saying about the vitamin D. Okay.
That's brilliant. Thank you very much. Can I just add to that I have been personally I've been unable to book for a flu vaccination, and I spoke to the pharmacy at one of the local supermarkets who said that that they didn't know when the stock would be coming in.
So this is the ongoing thing. They're basically prioritising certain areas and certain groups at the moment. It might be the fact that, Rachel, you look very, very young, and it might be it might be to do with that factor as well. Please don't worry about it. Have you been contacted by your GP practice yet?
I haven't, no.
No, that might be the reason why then. So what they're doing is they're doing almost like a wave of individuals. So you're probably not in that wave at the moment. So that's the reason why. But please be reassured. Actually, it is going to be rolled out. What they're having to do is they get the stock in and they have to do certain waves at certain points. And that's the process we take forward.
Okay, thank you very much. Very grateful for the answer.
Thank you. So moving on now to agenda item 22, the Designing Our Neighbourhoods update. And I believe that's Katie or Matt, possibly.
Sorry, I was going to speak to Charles. Is that okay?
Martin.
Okay. No, and really, obviously, the brief paper's in the pack, but I wanted to provide just a sort of a change, because just due to all the work that's underway with COVID planning, what we were going to do was to put back the workshop until later on in the calendar or the financial year, but just because we don't feel it's right given all the other work that's underway. So we're still working at a neighbourhood level in terms of a lot of the projects we're doing, but we feel that it's actually appropriate at this point to push back running the workshop until later after we sort of manage the next wave of COVID. So apologies for sending in a sort of an update to our proposal, but just the way the work is sort of panning out at the minute, there's a huge amount of work underway, and we feel that it would be more appropriate just to put this back a few months.
Katie's got her hand up. Go ahead, Katie.
Yeah, I fully support Martin there. Things are slightly delayed, but that's not to say that actually we aren't doing things on a designer neighbourhood perspective, and there's lots of things going on. One big success is that we have been focusing heavily on mental health, and we've been rolling out with the support of Citizens Advice Bureau the One Front Door service, which is ultimately work of the Design Our Neighbourhood conversation as well. We also did some motivational interviewing training, which I'm delighted to say 30% of the actual attendees actually came from Wokingham Borough Council. So a really good piece, and that's been collaboration across the actual partnership going forward.
Okay, thank you, Katie. So that's noted. So the next agenda item is obviously an update on the current COVID situation. There's a report in the pack, but I'm guessing it's Ingrid to talk to this.
Yes, it is. Thank you, Charles. And I'm going to share the one in the pack, I'm afraid, is a bit of a placeholder of last week's data. So the up-to-date one here should be shared on with you now. Is that right?
I can see it.
Great, thank you. So it's just to briefly go over the COVID situation report. This is the report that we produce each week that goes up onto the council's website on a Friday. So as I'm sure most everyone's aware, the national and local picture, including Wokingham's picture, is of a rising number of cases. We currently have had 820 cases since the very beginning of the outbreak. That does remain as a rate 479 per 100,000, which is well below the England rate of 827 per 100,000. What we can know is that this increase in cases is representing a increase in community transmission. So there is a rising number of cases across Wokingham. The blanks here are due to low numbers. They don't mean zero. So there is an increase of cases across the whole of Wokingham representing community transmission. You can see here clearly that we are in a second peak or going towards a second rise here of cases, which represents the same pattern as both the South East and England. We do remain in a situation where we have no excess mortality, which is shown here in this graph. The grey line here is what we would expect. You can see the excess mortality that we had here earlier in the year, and we remain well below and have no excess mortality due to COVID at the moment. And this gives more of UK cumulative total. But that's the sum up of our situation, but I'm very happy to take questions on COVID.
Any questions for Ingrid? Would appear to be no questions for Ingrid, so thank you very much, Ingrid. I don't think there's, going back to the agenda, I don't think we have anything else to consider. So no, right, yes, forward programme. The forward programme was in the pack, page 59 to 62. Any questions, any issues on any of that? No, good. I think in terms of any other items which the chairman decides are urgent, the only thing I wanted to mention is we'll be aware of the Sarah Rayfield came to do a presentation to us on the joint health and wellbeing Berkshire strategy at the last meeting. She sent me a separate note saying if any Wokingham Wellbeing Board members want to attend their prioritisation meetings, 8th of October at 2 to 2:30, 5th of November at 2 to 3:30, and 10th of November 2 to 3:30. So 2 to 3:30 on the 8th of October, 5th of November, and 10th of December. So I think if there's any other business from anyone. No? Okay, well, I'll say thank you very much and thank you for your time.
Thanks, Charles.
Thank you.
Cheers, thank you very much.
Bye.
Bye.
Thank you.